This week on 1,000 Ways to Hurt Your Back. Barbara is a 75-year-old adrenaline junkie looking for a thrill, and skydiving will give her that great high she has been looking for. Barbara goes skydiving and finally reaches that all-time high. Well, when Barbara reaches the ground, she is over ecstatic and quickly jumps up and wants to skydive again. Well, a couple steps towards the car, she steps and feels an instant pain in her back.
Little did Barbara know that she was subject to the bone disease called osteoporosis. Osteoporosis refers to a group of diseases which bone resorption outpaces bone deposit, making the bone very fragile. This can come from a lack of estrogen in the human body. With one step that Barbara took, she crushed her vertebrae, interrupting the function of the intervertebral disc.
Let's just say that Barbara will be watching her steps from now on.
And they're off. Days of Thunder had a little bit of an awkward start. My wife knows everything broke well. Galaxy is up and on the pace. Casanova and Tennessee Tuxedo are neck and neck, tied for first. This should make for a great race, ladies and gentlemen. Look at these horses go. I'm going to take a quick break to explain to you all the fascinating structure of a horse's vertebral column. If it were not for a horse's highly specialized vertebral column, a horse would definitely not be able to participate or run in races such as this one. First, let me inform you on the overall layout of a horse's vertebral column. A horse's spine consists of several cervical vertebrae, 18 thoracic vertebrae that are connected to the rib cage, 5 lumbar vertebrae, 5 sacral vertebrae that are fused together, and finally 5 coccygeal vertebrae that make up the tail. While the thoracic vertebrae have dorsal spinal processes that provide a site of attachment for the muscles that support the head, neck, and front legs, the sacral vertebrae supports the horse's hind legs. While most of the horse's vertebrae are rigid, the vertebrae in the neck and tail are extremely flexible, allowing a great deal of movement to occur there. Between the vertebrae and the horses are discs consisting of cartilage and soft tissue that absorb the shocks and jolts produced by movement. Because of the way that the vertebrae and intervertebral discs are arranged, a horse is able to support a large amount of weight and pressure on its back, such as a human, for instance, for an extended amount of time. Hope y'all enjoyed today's race, ladies and gentlemen.
Penny?
Yes, Dr. Osteon?
I have some unbelievable news, and I have some bad news.
Well, Dr. Osteon, what is the unbelievable news?
Well, the unbelievable news is that I have not had a hug in about in a week.
Lies! No. You must be lying to me!
No, I only speak the truth. Now the bad news is you have a herniated disc.
No, Dr. Osteon. How did I get this disc of herniation?
Your spinal disc becoming less elastic. Because it becomes less elastic, it can rupture, causing a portion of the spinal disc to push outside its normal boundaries.
But Dr. Osteon, whatever shall I do?
First of all, you need to relax, walk some, take some pain medications when needed.
Is that all I need to do, Dr. Osteon?
Yes, that is all, baby.
Thank you so much, Dr. Osteon.
We have in studio with us today Erin McClure of the North Greenville women's soccer team to discuss with us what happened in that violent collision. Hello, Erin. Can you explain to us what injury occurred when you were hit?
Good morning, Rachel. Well, the play itself was rather dirty, with a player coming from behind with such a direct hit. But sometimes players can get out of hand. We knew going into the game she was a dirty player, already receiving a suspension this season, but it was a risk we needed to take. Anyways, I suffered a dislocation of my intervertebral joint.
What were you feeling or thinking that moment you were hit? Did you know something was wrong?
As soon as I was hit, I knew it was bad. The excruciating pain I was feeling in the middle of my back was like none I had ever felt before. Sports account for 15% of spinal injuries, and 80% occur between the ages of 18 to 25.
Interesting. So what happens in a dislocation of the back, and how soon will you be back on the field?
Well, in a dislocation like mine, the ligaments and discs forming the intervertebral joint come out of alignment, which requires stabilization surgery quite often. But luckily, mine was a subluxation, or partial dislocation, where there is still some contact between the cartilage and the joint. I was fitted for a brace and expect to be back on the field in 8 to 12 weeks.
Are there any concerns that accompany this type of injury?
There are going to be concerns with any type of injury. In the case of an intervertebral dislocation, returning to play too quickly can result in permanent nerve damage. Also, if the disc doesn't realign correctly, it can cause pain and stiffness. If there's an underlying disease in the musculoskeletal system, such as one affecting the ligament laxity, the recovery may suffer complications.
So after suffering this injury, are you worried about going back to the field or having any other back problems down the road?
I'm not worried about playing again. You know the risks you take when playing any type of contact sport. As for problems down the road, there's a chance of wearing an intervertebral disc, but the doctors working on me have done a great job in catching the problem early and placing me on a strict rehabilitation program.
Well, thank you, Erin. I look forward to seeing you on the field soon.
Thank you, Rachel.
Ainsley Dobbs, the player who initiated the contact, has received an ejection from the league for the season and has been fined for her rash playing tactics. Coming up after the break, we take a look at the top plays for the week. This is Rachel Roundtree reporting from Tigerville, South Carolina.
Hey y'all, Explorer Kyle here. Today we're going to be observing the white-throated kingfisher of the air and the dolphin of the sea. Both are extremely fascinating creatures and both have rather unique vertebral columns. Today we're going to be experiencing the awe and wonder of the vertebrae of these creatures. Today we're going to be looking at the white-throated kingfisher bird. A bird's vertebral column is extremely unique. Unlike the vertebrae of a mammal or a reptile, the majority of the there we go! There it is. We got one. Unlike the majority of the bird's vertebrae, the exception of the cervical vertebrae are fused together. The fusion of the bird's lower vertebrae enables the trunk of the birds to stay still during flight. On the other hand, because a bird must be able to rotate its neck up to 180 degrees to accomplish tracks such as grooming its feathers or pecking for food, a bird is has an extremely flexible cervical neck vertebrae. While a human has 7 cervical vertebrae, the bird has 8 to 25 cervical vertebrae. Beneath the cervical vertebrae in the dorsal region, which would be the thoracic region in the human, has 6 and 10 vertebrae. The dorsal region in a bird's vertebrae provides achievement for the bird's ribs. The sinus sacrum, which corresponds to the sacrum in the human, lies in the dorsal region and has between 10 and 22 vertebrae. The next region of a bird's vertebrae is the caudal region, which consists of 5 to 10 fused vertebrae. Function of the caudal region include place of attachment for feathers and control during flight. The caudal region resembles the coccyx in the humans. Finally, the phagostyle signals of the end of a bird's vertebral column has 4 to 7 fused vertebrae. The phagostyle also supports birds' feathers. Compared to other animals, a bird has an exceptionally small tailbone that it uses to change direction in mid-flight. As you can see through its vertebrae, the white-throated kingfisher is an extremely unique creature whose skeletal structure greatly affects its needed function. Now, on to the dolphin. Look at it swim. Look like the bird, a dolphin's vertebrae are also unique in their design. A dolphin's vertebral column is extremely flexible, unlike most animals. The intervertebral disc between a dolphin's vertebrae is centered at the axis of rotation and is usually very stiff, which enables the dolphin to swim more smoothly. Like the other animals, a dolphin is susceptible to vertebral injury, which ultimately hurts the dolphin's ability to swim. Intervertebral disc disease can also result in back pain and hinder the dolphin's ability to swim and the smoothness of it. The reduced thoracic spinous processes and unfused vertebrae, length of sacral vertebrae, set dolphins apart from other animals and humans as well. The dolphin has 7 cervical vertebrae, 13 thoracic vertebrae, 22 lumbar vertebrae, and 31 caudal vertebrae. These cetaceans use the caudal third of their back mainly to swim. Fascinating creatures. Thanks for being here with us. Join us next time as we go deeper into the anatomy of a narwhal.
Today, we will be discussing the spinal columns and the joints that compose it. The spinal column allows us to stand upright, move in many directions, and give our body structure and support. 33 vertebrae are the bones that form the essential mechanisms inside our body. The spinal column is made of many vertebral bones formed together. The bones are connected together by an intervertebral disc. One joint is made of 2 vertebrae and an intervertebral disc separating the two. The disc is composed of a strong outer ring of fibers called the annulus and a soft jelly-like center called the nucleus pulposus. The annulus is a ligament and the strongest area of the disc. It is the outer layer and keeps the disc intact. The nucleus has a high water content and gives as a shock absorber quality, much like a waterbed. The presence of the disc allows for 2 of the vertebrae to slide against each other, providing movement and little to no friction. The vertebrae are the building blocks of the spinal column and bear the majority of the weight. They contain a hole in the center for the spinal cord to come through and be protected. The strong casing of the bone protects those delicate nerves that control many of our body functions, such as finger moving and hand waving and kicking and smashing things. The body of the vertebrae is large and round portion of the body. Other parts include the laminae that extend from the body to encase the spinal cord. The spinosis process, which is the opposite, the body creating like dinosaur-like appearances on the back. 2 transverse processes attach the deep back muscles to the vertebrae. And last thing, the pedicule is a bony projection on both sides of the lamina. 2 facet joints between each pair of vertebrae join the vertebrals together. The inferior articular facets of one vertebrae articulate with the superior articular facets to form synovial joints that allow movement between the bones, allowing you to bend and move in many ways, such as this. And then the classic SpongeBob, around town. Here we go, around town. The spinal nerves pass through the intervertebral foramen. This foramen is formed by the notches of the pedicle and at the superior and inferior edges. The thoracic vertebrae specifically are unique in that they contain articular and costal facets for the ribs to attach. Supraspinosus ligaments connect to the spinosus process tips. The interspinosum ligaments connect to the base of the spinosal process, and the intertransverse ligaments connect to the transverse processes. Also, the lamina of the adjacent vertebrae is bound together by the ligamentum flavum. The partaspinal muscles refer to the muscles next to the spine for support and motor movement. There are 2 thin muscles, the serratus posterior superior and the serratus posterior inferior. They overlie the deep muscles, connect directly to the vertebral column. So, as we have learned today, the vertebral column is an important part of the body. The joints that compose this structure are the tools necessary to allow for a variety of motion in different directions while still supporting the whole skeleton and bearing your weight.